Welcome back to Cancer Buzz, the podcast of the Association of Community Cancer Centers. I'm your host, Summer Johnson. On today's mini-episode, a model for embedding primary care providers into the cancer service line. Since 2011, the annual ACCC Innovator Awards have recognized many creative and cost-effective solutions from ACCC member programs and practices, delivering high-quality, patient-centered care in communities across the country. This episode is part of a Cancer Buzz series highlighting the 2022 winners. ChristianaCare's Helen F. Graham Cancer Center and Research Institute in Newark, Delaware, now employs a primary care provider, or PCP, to address comorbidities in patients who are in active anti-cancer treatment. Debra Delaney is the primary care nurse practitioner who leads this new PCP program.
There's many reasons why patients do not always have an established relationship with a primary care. One is they feel well and they don't see a reason to go. Another reason is transportation, sometimes cost. Sometimes their primary care retires and they need to find a new one and it gets pushed to the bottom of the list. And sometimes there's a fear that they don't really want to know. They may feel or realize there's an issue, but they just kind of push it off thinking it may go away.
Debra, what inspired you to develop this model of incorporating primary care into the cancer program?
The idea for embedding a primary care practice within a cancer center came from an informal survey that was completed in gynecological oncology practice, and it was found that 15% of their patients did not have a primary care provider. So the idea was formed, and by embedding a primary care practice within the cancer center, this allows the specialties for oncology, hematological, and surgical oncology to focus on their program and allow the primary care to address those needs.
What does that relationship between your program and the cancer team look like?
At this time, I'm the only primary care provider. Hopefully, as the program grows, we can add on more staff. But all of the other disciplines have been very open to me and reach out to me if they have any concerns about a patient or if there is an issue that comes up during their treatment. They can contact me and I can get the patient in and treat the issue at hand.
How does that interaction work? Are they screening patients and then referring to you?
So it's a little bit of everything. The front desk does do a screening asking if the patients have a primary care provider. And then when the physician, the oncologist or hematologist, the specialist talks to the patient, if there is an issue noting increased blood sugars or high blood pressures or some other issue that they feel is more primary care related, they may ask the patient, do you have a primary care to follow up with? If there's not one listed, or if there is one listed, sometimes it's been a while since they've seen that doctor. If they don't have an established relationship with a primary care provider, then the oncologist sends down a referral to me. Additionally, I attend multidiscipline conference, and when the patients come through to determine a cancer treatment plan for them, at that time, there's nurse navigators, and they will ask the patient as well if they have a primary care provider. The nurse navigators will reach out to me. The care management team as well can also reach out to me.
Talk to your colleagues about the big picture. Why should primary care and cancer teams work together?
So I have a patient currently who is referred for surgery for a cancer. And during her initial lab work, her blood sugar was noted to be extremely elevated to the point where they can't do surgery. It's considered a high risk. So she was referred to me, and I have started to bring down her blood sugars to prepare her for surgery. She had not seen a primary care in, I believe, 40 years.
Debra, how did this process impact your own job satisfaction and engagement?
So I always enjoyed primary care. And by being there for the patients, I can help them navigate through this process in oncology as well. We have a lot of support for our patients with the nurse navigators, with social work, and the oncologist. And then with primary care, it's an extra layer of support. When patients call me up and say they have a question about which testing they need next, or where they should go for imaging, or any kind of question at all, it makes me happy that I can provide this care for them. I get my satisfaction from helping them. So being there for my patients, it adds an extra layer of support for my oncology patients because they know that they can reach out to me with any question that they may have. And I get great satisfaction from caring for them.
You can learn more about the model discussed today at the upcoming ACCC 39th National Oncology Conference. That's October 12th through the 14th in West Palm Beach, Florida. There's more information and a link to register in the show notes. Until next time, for the Cancer Buzz team, this is Summer Johnson.
Cancer Buzz is a resource of the Association of Community Cancer Centers.